Welcome, everyone. Thank you so much for joining today. My name is Autumn Hume. I am the Account Director with the Muscular Dystrophy Association's Healthcare Partnerships team. Thank you for joining us today for the MDA Industry Update webinar, PREVAIL Phase 3 Study in Generalized Myasthenia Gravis, presented by Alexion. MDA's Industry Update webinars are programs which provide an opportunity for the community to receive information and updates impacting care and treatment directly from pharmaceutical, biotechnology, and medical equipment companies. These webinars are just part of MDA's educational resources. We encourage you to visit community education pages of mda.org. You will find an abundance of resources, informative recorded webinars, and listings for upcoming educational events. Of course, if you have questions or need assistance, the MDA Resource Center is available to you by email at resourcecenter@mdausa.org, calling 1-833-ASK-MDA1, or you can reach the Resource Center on mda.org. At the end of this webinar, you will receive a survey link. Please take the time to complete this short survey so that your voice is heard, and you can help us create more impactful programming for future events. Now, I would like to turn it over to our speakers today. Sanjay Rakati, Executive Medical Director, Alexion AstraZeneca Rare Disease Unit, and Joachim Schultz, Medical Director, Clinical Development and Translational Sciences, Alexion AstraZeneca Rare Disease, for today's webinar. Thanks so much.
Thank you, Autumn, for that kind introduction, and thanks to the Muscular Dystrophy Association for giving Alexion the opportunity to present at this MDA Industry Update webinar. We are truly excited about the Phase 3 PREVAIL study, which is evaluating Gefurulimab in generalized myasthenia gravis, and excited to present information about it to this audience here today. As a brief introduction to myself, my name is Sanjay Rakade, and I'm a physician scientist currently working at Alexion AstraZeneca RDU here in Boston, Massachusetts. I'm a neurologist by training and have, prior to my biopharmaceutical career, worked on the faculty of Boston Children's Hospital and Brigham and Women's Hospital in the Department of Neurology at Harvard Medical School. And it's truly, again, a pleasure here to speak to you about the PREVAIL study. During the course of my presentation today, I'll be telling you a bit more about Alexion AstraZeneca as a company, our goals, then talking a bit more about the complement system, and specifically about the role of the complement system in generalized myasthenia gravis. So without further ado, just to tell you a little bit more about Alexion and our core values. Alexion is a patient-focused and patient-centric company, and we truly believe that our legacy will be measured in the families that we serve today with the medications that we bring forward for our patients. We aim to give our patients more than hope. We're always striving to try and give them a future wherein they live to their maximum possibility despite the disease that they may be suffering from. Alexion is present in 4 core therapeutic areas: hematology, nephrology, neurology, metabolic disorders, and bone disorders. We truly believe that we carry a shared responsibility for delivering innovations that benefit citizens and our patients. And we currently are serving patients with marketed products in 7 disease indications, including generalized myasthenia gravis, NMOSD in neurology, and other disorders in hematology, nephrology, and metabolic diseases. We have more than 30 years of experience in the complement biology field. And on the next slide, I will just tell you a bit more about our prior work in complement-mediated diseases. So as I mentioned, we have been leaders in the complement-mediated disease space and complement biology for more than 30 years now. And our company is committed to treating complement-mediated diseases. We have, at this time, more than 17 plus clinical trials in late-stage development space, phase 2 or phase 3s, that are being conducted in across 50 countries. And I have accumulated over 60,000 patient years worth of clinical trial and real world data in these complement-mediated diseases. We, as a company, have had the opportunity and good fortune to treat more than 30,000 patients with complement-mediated diseases. And we continue to demonstrate strong commitment by investing and advancing the science to deliver innovative treatments to address some of the most important needs of our patients with these disorders. Next slide, please. So with that brief introduction to Alexion, I'll tell you a bit more about the complement system and its role in the generalized myasthenia gravis disease space. So what are complement proteins? The complement proteins are an integral part of the body's immune system, and they help the body's cells fight infections and clean up debris that are present due to various biological processes. To date, there have been more than 30 proteins that have been identified to make up the complement system. And these complement proteins help to protect our body against infections, against attack by bacteria, and removing the damaged cells and healing wounds after injury. So the complement system is turned on or triggered by exposure to bacteria that have entered the body and also by other molecular signals that come on when the body is exposed to damaged cells or after injury as such. In certain instances, a process called as autoimmunity also triggers or turns on the complement system. The components of the complement system that are activated then go ahead and start a distinct reaction sequence that is called a pathway. And these activated complement proteins perform their function and turn on the next protein in this pathway via a cascade of events or a positive feedback loop, as we call it. At the very end of this activation pathway, the complement system may result in the formation of a molecular complex that's called as the membrane attack complex, or MAC. And this is the effector aspect or the effector of the destruction of that is achieved by these complement system of the targeted cells or of the bacteria and other injured cells as such. In our understanding, there are three major pathways that get activated through the complement system: the classical pathway, the lectin pathway, and the alternative pathway. But all three of these pathways coalesce or come together on a common factor, which is called as the complement component C5. And activation of this complement factor C5 is the initial step called as the terminal step for the formation of the membrane attack complex as such. And this will be an important thing to remember as we move further and talk more about the complement system. Next slide, please. So how does the activation of the complement system contribute to muscle weakness? As many of you may know, the muscle system or the muscular effects that are produced by the voluntary contraction of muscle cells. And this requires the release of a neurotransmitter, which is called acetylcholine from nerve endings. So in the pictograph that you see on the right side of this slide, the inverted mushroom-shaped green structure represents a nerve ending. And you can see acetylcholine molecules being released or the neurotransmitter being released from this nerve ending. This neurotransmitter then binds to receptors on the orange membrane that you see below. That is the motor end plate. And binding of the neurotransmitter leads to activation of receptors that then leads to muscle contraction and the muscle movements that we see. In myasthenia gravis, more than 80 to 85% of patients carry autoantibodies against this neurotransmitter receptor for acetylcholine called as AChR receptor. There may be other autoantibodies as well that interfere with other aspects of AChR clustering. For example, antibodies directed against MuSK or LRP4 or some of these other proteins, but they are a smaller proportion of the total patient population. As I mentioned, more than 85% of the patients have autoantibodies against the AChR receptor as such. The AChR autoantibodies cause receptor loss and interfere with the function of clustering of the receptors, transmission of these receptors or transport of these receptors, and recycling of the receptors. And once these autoantibodies form a cluster, that drives complement activation and drives the membrane attack complex formation that leads to structural changes and damage to the muscle membrane, and also to the reduced efficiency of signal transmission at the orange part that you see there, the motor end plate. All of this can produce damage to the muscle motor end plate and subsequently lead to irreversible damage of the muscle as well. We at Alexion have previously shown the potential of targeting this membrane attack complex in myasthenia gravis. We have shown with two of our C5 inhibitors or complement factor 5 inhibitors in two large phase 3 studies, the ability to show a rapid improvement in symptoms of myasthenia gravis. The REGAIN and CHAMPION MG studies have been conducted with eculizumab and ravulizumab, respectively. In the REGAIN study, about 125 patients of treatment refractory or treatment resistant generalized MG who were positive for AChR antibodies received treatment with eculizumab. And in that trial, 2 to 3 times as many patients showed improvement with eculizumab active treatment as compared to treatment with control or treatment with placebo. This benefit was observed as early as within 4 weeks of start of treatment. And importantly, MG exacerbations or life-threatening exacerbations caused by myasthenic crisis were also reported to be significantly lower in the eculizumab group as compared to the placebo group. Furthermore, in the CHAMPION MG study of ravulizumab, we have again demonstrated the benefits of C5 inhibition. In a clinical trial with about 175 patients with generalized myasthenia gravis who were AChR autoantibody positive, treatment with ravulizumab led to significant decreases in the patient-reported myasthenia gravis scale of activities of daily living, as well as physician-reported measures of disease severity such as the QMG. The QMG muscle strength improved in 3 times as many patients in the ravulizumab group as compared to the placebo group. And importantly, these treatment effects were long-lasting. So all of this just goes to show the potential of C5 inhibition and the demonstrated efficacy of this complement factor 5 inhibitors in generalized myasthenia gravis as such. We are truly excited to bring forward this same mechanism of action in the PREVAIL study. And my colleague, Dr. Joachim Scholz, will now talk a bit more about the actual PREVAIL study and some of the details therein. So handing it over to you, Joachim.
Thank you, Sanjay. My name is Joachim Scholz. I'm also working with Alexion. I joined the company 3.5 years ago, and my first task was actually to examine the safety and tolerability of this new molecule, Gefurulimab. I can tell you it's a really rewarding experience to see this new treatment option for patients with myasthenia gravis move forward at such a pace to a phase 3 trial and have the opportunity to test its efficacy and safety in patients who are suffering from this disease. As Sanjay mentioned, we have experience with the mechanism of action. We have tested C5 inhibitors in the past. Soliris or eculizumab was the first molecule that was approved as a targeted treatment for myasthenia gravis. It laid the foundation for the use of complement inhibitors in this disease. The next molecule, as Sanjay has mentioned, was Altamir's or ravulizumab. The advantage was that this medication is needed to be infused only every 8 weeks compared to every 2 weeks for Soliris. So it is the extension of the half-life that provided the improvement. But we continue to listen to patients, and it drives the discovery process and also the priorities that we see for the development of new treatment choices. With Gefurulimab, we are making a fundamental change. Here we are developing a treatment that we can put into the hands of the patients so that they are no longer dependent on infusions and can see more flexibility in their therapy. Gefurulimab is developed for subcutaneous injection. It's an injection under the skin, similar to insulin for patients with diabetes mellitus. We think that this treatment, if we can demonstrate its efficacy and its safety, will provide greater independence, autonomy to patients, and flexibility in their normal lives. The first study that Alexion conducted for this new molecule was a large phase 1 study. In phase 1 studies, you look at key parameters of safety and also how this new treatment is tolerated by the participants in these studies. They are usually healthy adults, and this was also the case for the first trial of Gefurulimab. Altogether, we enrolled 97 participants in the study. They were administered either a single injection of Gefurulimab, starting very low with 30 milligrams and going way above the expected dose that we would administer in a clinical trial, 1,700 milligrams. We also treated some of the participants with multiple doses that were given in weekly intervals, and they range from 100 to 600 milligrams. And those were given for up to 2 months. And within that range of doses was also the dose that we are currently testing in the PREVAIL study. I can tell you that all doses were well tolerated. We did see, as expected, some adverse events, but all of them were of mild or moderate severity. We did not see any serious adverse events. In fact, the most frequently reported events were common colds or viral upper respiratory tract infections and headache, and they were observed in both participants who received Gefurulimab as well as participants who received placebo treatment. Placebo is a comparator formulation, very similar to the active drug or the active medication, administered in the same way, but it is not containing any active substance. Gefurulimab is now moving forward. We have developed a pre-filled syringe to make the administration easy. Participants in the PREVAIL study are trained in the injection technique. It is fairly quick. It takes only a few seconds to inject. And like I said before, the treatment schedule is also comparatively light. It's a once weekly injection of the dose. And that injection is supposed in the future to be administered at home. In fact, participants in the PREVAIL study take those pre-filled syringes already at home once they are familiar with the administration and continue injecting these doses on their own. The PREVAIL study is a fairly ambitious undertaking. We are present around the globe in more than 20 countries. In Northern America, that includes the United States of America and Canada. We also recruiting study sites in Argentina, Brazil, across Europe, in Turkey and in Israel, and in China, Japan, and Taiwan. So it's a truly international study. It is randomized, so that means that participants are assigned to 2 different treatment arms, as I will explain in a moment. It's double-blind. Neither the participants nor the physicians involved in the study know which participant gets active treatment, Gefurulimab, and which participant receives a placebo. This schematic shows you an overview of the study design. There are 3 periods. First, we have a screening period of up to 4 weeks, during which we examine the eligibility of participants, whether the diagnosis of myasthenia gravis is secure, whether they have autoantibodies against the acetylcholine receptor, and whether there are no diseases that would speak against participation in the study or mean an increased risk. After this screening period, we have this random assignment to the 2 treatment arms, Alexion 1720, which is the code for Gefurulimab, or placebo. That treatment period stretches over 26 weeks or half a year. In the beginning, all participants are trained in injection techniques. After that, they take the medication home, as I mentioned, and return to the clinic only every 6 to 8 weeks. So it's a fairly lean visit schedule. All participants will enter an open label extension. That's a period where everybody gets Gefurulimab, independent in which treatment arm they were first assigned. And that open label extension goes over slightly more than 2 years or 105 weeks. Participants can, or patients, I should say, can join the study when they have an established diagnosis of myasthenia gravis and autoantibodies against the acetylcholine receptor, because only those participants in the study will benefit from treatment with the complement inhibitor. All participants must be adult, 18 years or older. The symptoms must extend beyond eye muscles, so participants or patients with myasthenia gravis may have droopy eyelids or double vision. It has to be more than that. There has to be some weakness of speaking, swallowing, perhaps a difficulty of breathing, or weakness in the arms or legs. It has to be a generalized disease to participate in this study. It's okay if participants don't want to inject themselves. We accept that a caregiver is coming to the training sessions and learns how to administer the medication. They can then do so for the remainder of the study. We know that some patients with myasthenia gravis have been diagnosed with thymus tumors. Therefore, there are some rules regarding those tumors. They all have to be treated, and surgery, if that was part of the treatment, has to have occurred at least 12 months ago before joining the trial. It is okay if participants have had experience with a complement inhibitor, Gefurulimab or Ravulizumab in the past, as long as they tolerated that treatment well. The study is free. There are no charges for the participants. There's one aspect that I want to mention. All complement inhibitors have an increased risk of inflammation of the meninges, or they can cause meningoencephalitis. To protect participants in the study against this risk, everybody who enters will be vaccinated against these meningococcal infection, as we call them, and that should provide sufficient protection against this risk. We do have a website. If you want to learn more of the study, you can go to prevailmgstudy.com. We have also registered the study at the official platforms in the United States. That's clinicaltrials.gov, and there's a certain numerical code assigned to the study, but you can simply look for Gefurulimab or Alexion 1720 and Myasthenia Gravis, and you will find this study. The last aspect that I wanted to highlight is our commitment to diversity. We know that often enough clinical studies are performed with a preference for the inclusion of white patients, Caucasian patients. Alexion is really committed to have a patient population in its trials that is representative of the presence of minorities in our population. So we are very mindful when we select study sites. We are present in a lot of states and make sure that we go to places where we have a chance to also recruit from a diverse patient population to make our studies valid and representative of the population for which we ultimately develop our medications. With that, I want to thank you for attending this seminar and your interest in learning more about the PREVAIL study. And I think we have a few minutes left to take questions.
If you have any questions, please go ahead and type them into the chat, or you can also use the Q&A box. And we will do our best to answer them. Don't see any coming through. So if you do have questions after today's presentation, please do feel free to reach out to us. Oh, here's one that just came through. Can you be in the study if you are on Vyvgart?
Excellent question. Right to the point. That's actually one of the treatments that we, at this time, do not allow because we have not the experience in a combination with this very new treatment. So if you have started treatment with GERD, you would not be eligible to take part in the PREVAIL study. Thank you for this question.
Thank you. Any other questions? Oh, go ahead, Sanjay.
The one quick addition there would be that if for medical reasons you have discontinued any of your prior treatments and have gone through a washout period, that's 5 times the half-life of the medication that you're taking, then potentially you may be eligible based on other criteria within the study.
Great. We just have a comment, great presentation, future hope, and thank you. And with that, I will say thank you to everyone for joining today. This industry update webinar presented by Alexion. We hope you will join us for future industry update webinars, and I hope everyone has a great day. Oh, it says there's another question. Sorry, one more. Are you taking anyone who is post-COVID long haulers?
That's a possibility. Yeah, there's no particular reason why we would not include participants. From the question, I take that the person asking is thinking about patients who have recovered from long COVID syndrome, and that would be fine. I mean, we definitely make sure that patients are not exposed to any increased risk, so there shouldn't be an active disease process that we would take into consideration and discuss with the physician who then enables the interest or facilitates the participation in the study.
Good question.
Well, if there are no further questions, once again, Autumn and all the participants on the call really appreciate your giving us the opportunity to talk about the PREVAIL study, and a special thanks to the MDA for facilitating this conversation.
Thank you so much to Alexion for being a part of it, and we look forward to holding these again in the future.